Here is the complete voiceover script. Most people assume Medicare is automatic. You turn 65, the government sends you a card, done. And for Social Security recipients, that part is mostly true. But for everyone else, and that's a lot of people, Medicare enrollment is something you have to initiate yourself inside a specific window. Miss that window, and Medicare charges you a monthly penalty. Not a one-time fee. A permanent surcharge added to your premium every single month for the rest of your life, according to Medicare.gov. Today we're going to walk through the 3 enrollment periods Medicare uses: the Initial Enrollment Period, the Special Enrollment Period, and the General Enrollment Period, and explain exactly how the penalty works, who qualifies for an exception, and what to do if you're not sure where you stand. By the end of this video, you'll know which window applies to your situation and what steps to take before you turn 65. Let's start with the situation most people find themselves in. You're approaching 65. Maybe you're retired, maybe you're still working. Someone mentions Medicare, and you realize you haven't thought this through yet. The question most people have is simple. When exactly do I have to sign up, and what happens if I don't do it on time? The answer depends entirely on your coverage situation right now, and that's what we're going to sort out. The first enrollment window is the one everyone gets, no exceptions. Medicare.gov calls it the Initial Enrollment Period, and according to Medicare.gov, it lasts for 7 months. That window starts 3 months before the month you turn 65, includes the month you turn 65, and runs 3 months after the month you turn 65. So if your birthday is in August, your initial enrollment period opens in May and closes at the end of November. You have 7 months to act. Now here's a detail worth knowing, because it affects when your coverage actually kicks in. If you sign up before the month you turn 65, your Part B coverage starts the month you turn 65. If you sign up during the month you turn 65, or during any of the 3 months after, coverage starts the following month. According to Medicare.gov, coverage always starts on the first of the month. There's one additional birthday wrinkle worth knowing. If your birthday falls on the first of the month, Medicare treats you as if you turned 65 in the preceding month, which means your window and your coverage start date both shift back by a month. Medicare.gov spells this out clearly, so if you were born on the 1st, factor that in when you're counting your window. Now, what are you actually enrolling in? Part A covers inpatient hospital stays, skilled nursing facility care, hospice, and some home health care. For most people, Part A is premium-free because they or their spouse paid Medicare taxes for at least 10 years while working. That's the threshold Medicare.gov identifies. If you qualify, you get Part A at no monthly cost. If you don't qualify for premium-free Part A, Medicare.gov lists 2 possible premium amounts for 2026. $311 per month, or $565 per month, depending on how long you or your spouse paid into Medicare. That's a significant cost, and it's another reason to understand where you stand before the window opens. Part B covers doctor visits, outpatient services, preventive care, and medical equipment. The standard monthly premium for Part B in 2026, according to Medicare.gov, is $202.90. That amount can be higher depending on your income. Medicare.gov calls that higher amount an income-related adjustment, but $202.90 is the baseline most people pay. Here is where the penalty enters. According to Medicare.gov, if you miss your initial enrollment period and you don't qualify for a special enrollment period, you may pay a monthly late enrollment penalty for as long as you have Part B coverage. The penalty goes up the longer you wait, and it never goes away. That last part is the one most people don't hear until it's too late. The penalty accrues for every full 12-month period that you were eligible for Medicare but chose not to enroll. So missing by 2 years adds a larger penalty than missing by 6 months. This is not a fine you pay once. It is permanently added to your monthly premium. Medicare.gov is explicit about that. Let's put real numbers to it, because that's the only way this sticks. The standard Part B premium is $202.90 per month in 2026. If someone delays enrollment for 2 full years past the end of their initial enrollment period, they carry that penalty forever. The The math on a permanent surcharge over a 20-year retirement adds up to thousands of dollars. That is the cost of assuming Medicare would wait. Now here is the exception that saves most working Americans from that penalty. It's called the Special Enrollment Period. According to Medicare.gov, if you have health insurance through your current employer or through a spouse's or family member's current employer, you may be eligible to delay Medicare enrollment without triggering the penalty. This special enrollment period starts the first month after your initial enrollment period ends. And this is the part people miss. It ends 8 months after you lose that employer coverage or after your employment ends, whichever comes first. Notice what that means. The clock starts when the coverage ends, not when the employment ends. If you retire on March 1st and your employer insurance runs through April 30th, your 8-month window opens May 1st. You have until the end of December to enroll without a penalty. But the window does not pause. It is a hard 8-month deadline. There is a critical distinction here that Medicare.gov makes clearly, and it trips people up every year. The special enrollment period for delaying Part B without penalty is based on current employment and active employer coverage. COBRA coverage does not count. Retiree health coverage from a former employer does not count. Marketplace coverage does not count. Only active employer-sponsored group health insurance tied to current employment qualifies for the SEP protection. There's also a size factor that matters for some people. If you are disabled and your special enrollment period is based on a family member's employer coverage, Medicare.gov specifies that the employer must be part of a large group health plan. That condition does not apply in the typical case of a spouse's current employment, but it's worth knowing if your situation is more complicated. For people who missed both the initial enrollment period and any qualifying special enrollment period, Medicare provides one more option. It's called the General Enrollment Period, and according to Medicare.gov, it runs from January 1st through March 31st every year. If you sign up during that window, your coverage starts the month after you enroll. So if you sign up in February, coverage begins March 1st. The General Enrollment Period is the safety net, but it comes with two costs. First, you will typically still pay the late enrollment penalty on your Part B premium because the GEP does not erase the delay. Second, if you needed coverage between when your IEP ended and when you finally enrolled during a GP, you had a coverage gap during that time. That gap is uninsurable through Medicare retroactively. Let's step back and look at the clear decision framework here, because there are really 3 situations most people fall into. Situation 1. You are not working or you have no employer-sponsored coverage when you turn 65. Your window is the initial enrollment period, 7 months centered on your 65th birthday. Sign up during the 3 months before your birthday month to get coverage starting the month you turn 65 with no gap. This is the most straightforward path. Situation 2. You are still working at 65 with active group health coverage from your employer or your spouse's employer. You can delay Medicare enrollment without penalty. The special enrollment period protects you for 8 months after that coverage ends. Mark that end date on your calendar immediately when you retire or when coverage stops. Do not miss that 8-month window. Situation 3. You are past 65, did not have qualifying employer coverage, and never enrolled. The General Enrollment Period runs January through March each year. You can sign up then, coverage starts in April, and the penalty will be permanent. The sooner you sign up in this situation, the smaller the total penalty over your lifetime. Let's walk through a realistic example. David turns 65 in June 2026. He retired at 63 and has been on his wife's employer health plan since then. His wife retires in September 2026, and her coverage ends October 31st. David's 8-month special enrollment period starts November 1st and ends June 30th, 2027. He has until the end of June 2027 to enroll in Medicare Part B without paying a penalty. If he waits until the following January and signs up in the General Enrollment Period instead, he will pay a penalty on his monthly premium for the rest of his life because he missed the SEP. The coverage dates, the deadlines, and the distinction between employer-sponsored and other insurance. That's where most people make the costly mistake. Here's what to do next. First, Go to Medicare.gov and use their official enrollment information to calculate your exact initial enrollment period or special enrollment period based on your birthday and current coverage situation. The site walks you through it step by step. Second, if you are still working, confirm in writing with your employer's HR department that your plan qualifies as a large group health plan for Medicare purposes. This affects whether the SEP applies to you. Third, if you are within 2 years of 65 and have no employer coverage, put your enrollment window on your calendar now. The 3 months before your birthday month are the optimal time to enroll. You get coverage starting exactly at 65, with no gap. This video is educational content, not financial or legal advice. Medicare rules can interact with your specific work history, income, and coverage situation in ways that affect your best path. Verify your situation on Medicare.gov or speak with a state health insurance assistance program counselor. SHIP counselors provide free, unbiased Medicare guidance, and Medicare.gov lists them by state. The single most important thing to take away: Medicare enrollment is not automatic for most people, and the late enrollment penalty is permanent. Know your window, know whether your employer coverage qualifies for the SEP, and act before the deadline. If you've already gone through Medicare enrollment, I'd like to know in the comments. Did you sign up during your initial enrollment period, or did you use a special enrollment period after leaving work? Hearing real experiences helps people in this community understand what the process actually looks like. And if this video cleared something up for you, subscribing makes sure you see the next one. We cover Social Security, Medicare, RMDs, and retirement taxes, all in plain English, all sourced. Approximate word count: 1, 820 words / 12 minutes at 150 WPM. Key sourced figures used *. 7-month IEP, 3 months before / 3 months after. Medicare.gov IEP page. Coverage start timing by sign-up month. Medicare.gov. Birthday on 1 SD rule. Medicare.gov. 10-year work threshold for premium-free Part A. Medicare.gov cost page. Part A premiums $311 / $565. 2026 Medicare.gov cost page. Part B premium $202.90. 2026 Medicare.gov cost page. SEP 8-month window after coverage / employment ends. Medicare.gov, truncated but confirmed in the SEP table. GEP January 1st to March 31st. Coverage starts month after. Medicare.gov. Penalty is permanent for as long as you have Part B. Medicare.gov.